After 2 over years, today is really a happy day and marks a very important milestone. I just want to echo Minister Gan's words that it's a major milestone, and being able to announce a reduction of our pandemic status from orange to yellow. We know the danger is of course not over, but we can all breathe easier now. And I just want to say this is really a result of all our hard work, all our perseverance, all our collective effort. And I want to especially thank all our healthcare personnel and workers, everyone at the front line, all our operational staff, all hold up mostly in Harbourfront, dealing with case management, testing, vaccination planning, health protocols, etc. And all your contribution and sacrifices lead to the milestone today. And you are the frontline workers, the back-end heroes, also the last line of defense, and you made today possible. Thank you very much. Let me just briefly talk about the current pandemic situation. There are 3 statements really. Number 1, the pandemic situation remains stable. This is despite our decisive move on 29th March this year to open up borders and ease up on our SMMs. Notwithstanding that move, daily cases have been trending down over the past 3 weeks and have stabilized about 3,000 per day. It reflects the fact that our society is now a lot more resilient to the COVID-19 virus. Second is the situation in our hospitals. It is steadily improving, and DMS will elaborate further. I have earlier described a pandemic with rising cases like riding a bicycle downhill. It just goes faster and faster, and we need to apply the brakes until we land at the safety zone. I think we have landed in a safety flat ground now, but keep on pedaling. If not, the bicycle will stop and you will still fall. But we are now in a good position, flat ground, stable, steadily improving. Third thing is, notwithstanding all this improvement and that our bicycle is on the flat ground, we still need to be alert to risk over the horizon. What are these risks? One immediate one facing some countries is a resurgence of the Omicron infection wave. And this has started to happen in some parts of the US, for example, and this is driven by the Omicron BA.2 strain. However, this is less of a concern for us, given that the Omicron wave that we went through is already driven by BA.2 variant. A potential risk months down the road is when the protection conferred by vaccines and infections start to wane in our population, and then a new wave may emerge. And today, we have not seen new waves driven by a similar strain as earlier waves in other countries. But we should expect this to happen, even if they are not as large or severe as the previous wave that just passed. It's something that we must be alert to, because protection will wane, a new wave will start at some point. But it should not be as big as the previous one. The last and the most worrying risk, of course, is the emergence of a new VOC, or variant of concern. And this continues to be a potential curveball that may knock us back to square one, and we must be alert to that. These risks remind us not to be complacent and to be alert to possible future dangers. But on the whole, things continue to look up for us. Our social resilience is strong, and now we are in a comfortable position. We can therefore afford to take further steps to restore pre-COVID-19 normalcy. However, given the risk over the horizon, we should not declare a freedom day until the pandemic is truly over. Instead, we will step down but not dismantle our measures completely. By keeping certain levels of precaution, we remind ourselves that the pandemic is not over, and we retain the ability to reactivate selected measures if and when the situation requires them.